So the government shutdown has finally come to an end. And while most people think that's the end of the story, the real story is what's going to happen with people's health care. So what I'm going to do is I'm going to take you through exactly what's happening to those who are on the Affordable Care Act. I'm going to tell you why their health care premiums could go up, why hospitals could struggle, and why a lot of people might go uninsured. But stick around to the end of the video because I'm going to give you 5 practical things that you can do if you're affected by this. We're going to go over this article. This is from ABC News. The government shutdown has ended. What could this mean for the future of the ACA? So the way that the government shutdown ended up having to go on for so long was because there was a dispute as to whether the Affordable Care Act subsidies would continue. If they're stopped, that means many people, about 20 million or so, would have their health care premiums go up. So now the shutdown has ended, but there was no deal made on continuing those subsidies, and they're going to run out at the end of the year if nothing is done. The enhanced premium tax credits are set to expire at the end of the year. A Senate vote has been promised for later this year, although it's not clear if the credits will be extended. Health policy experts told ABC News that they expect healthcare costs to increase in the next year, which could hurt both individuals and the wider healthcare system. While the Senate has agreed that they will have a vote on it, the House has not. There is a lot of ambiguity as to whether this will even be talked about by the House. If the enhanced premium tax credits expire, some people will disenroll from the Affordable Care Act plans due to increased premiums. Experts add that the people who disenroll will likely be healthier individuals who don't file many claims or attend many doctor's visits. This will likely lead to insurance premiums increasing even further. What does that mean? That means that people who are young, people who are healthy, are going to see those tax subsidies disappear, those tax credits. And then when they go to enroll for health insurance, they're going to see, wait, my premium is double? It's tripled? They'll reason, well, I'm healthy, I feel good, I don't go to the doctor that much anyway. And they'll just disenroll because they feel like they can't afford it. And what's the point? Well, there's something that's going to happen, because if there's less people on the insurance plans, then the premiums will have to go up. It says that's part of the reason the premiums have been going up, because insurance companies realize that healthy people are more likely in this situation to drop their coverage, and sicker people are more likely to stay on. Additionally, there will be long-term impacts affecting hospitals, health centers, and doctors' offices. This is not something that is a simple issue to figure out. This is going to cause a lot of problems, not only for those sick people who stay on, but also healthcare centers, doctors' offices, and hospitals. I want to go further and just talk about how that's going to be affected, because this is something people didn't think about. When many heard about this, they just thought, okay, my health insurance costs are going to go up. They didn't think of this affecting the entire medical system, from hospitals, healthcare centers, and doctors' offices. Uninsured individuals will still need care in hospitals, or other clinics may have to negotiate directly with patients or seek government funding. This may result in hospitals eating some of the care costs, which could be harmful. That's because if you go to the emergency room, you cannot be denied from the emergency room in the United States. So people who have emergencies, they go there, they get the medical care, and they're going to get a bill. But instead of that bill being something that's negotiated between the hospital and the insurance company, that's going to be negotiated between the hospital and the person themselves, which means that this is going to take longer. This is going to cause a lot of bottlenecks within the system, a lot of issues within the system, and hospitals are not going to be making as much revenue as they did before. Any loss of revenue due to not having individuals who are insured, or having a low number of individuals who are insured, could harm the bottom line of most hospitals across the country. Hospitals are still, in America, revenue generating. That means that they have to make a certain amount of money. And because they're not making a certain amount of money, that could affect the overall healthcare system. As you've seen with some of these new laws that have gone in place, some hospitals have closed down, some health centers have closed down, some clinics have closed down. So now, what's the solution? What can you do as a person to get through this, the first thing you need to do, you need to log on to healthcare.gov, go to your state marketplace, and check your information. The reason why you want to check your information is to make sure that your income and household details are up to date. One of the big things was that they said there was going to be a vote on healthcare in December. But in all likelihood, that vote is probably going to end up with the ACA subsidies still ending at the end of the year. So you want to make sure that your income and household details are up to date so that you can see what plans are available for next year and that you can pay attention to any notices about potential changes. You want to make sure your account's clean. You want to make sure you know what's going on so that you have a clear before and after. So that's the number one thing. Number two thing, in all likelihood, these subsidies are going away. So right now, it's November 14th. Start budgeting for the possibility of higher premiums in 2026. This is no time to panic. This is time to take action. Budget now for what's coming in the future. Set aside a small monthly cushion right now. And if you're planning on spending that money, trim back your spending. Look at what you can cut. Do you got subscriptions that you can cut? Do you have services that you can cut? Whatever you can do to save that little bit of money, because you're going to need it in 2026. You can save $30, $40, $50. But that little bit will always build up to something. Now, here's the third thing that you can do that you really need to think about. Be very cautious about going uninsured. Now, why do I say that? If the subsidies disappear and your premiums go up, you might think, hey, I'm going to drop it. I'm healthy. I'm good. I'm going to take my chances. Well, let me tell you something about those chances. If you go to the emergency room, those bills can run $10,000 to $20,000 or more. One unexpected thing could take place and all your savings are gone. If you don't have savings, you wreck your credit. What does that trap you in? Years of medical debt. So think long term. Think about the opportunity cost. If I choose not to pay and I get in one accident and go to the emergency room, what's going to happen? Do the math and just really make a wise decision. Just because you're young, just because you're healthy, does not mean that an unexpected event can't happen to you. So now, the fourth thing you can do, just stay informed, see what's going on in the news, stick to reliable sources, and just make sure that you're up to date with how this is decided in the government. Fifth thing you can do, take a snapshot of what you're paying now, because this is going to help you to make a wise decision. This is going to help you to know how much you can save. This is going to help you to know if you need to drop your insurance or keep it. It will help with that long-term decision. And it'll help you to know, okay, what can I brace myself for what I'm going to have to pay? So, in conclusion, I always say the three things that these things can really help you too. It's, the brand of my channel, get out of credit card debt, build up a 6 to 12 month emergency fund, and simplify your life. You cannot control what happens when it comes to certain events in life, but you can control how you respond to them. Hey, I hope I helped out some of y'all today. What I'm going to do is I'm going to put another video up here for you all to go watch, and give my videos a watch. I'm trying to help regular people. Until then, y'all have a good one. Take it easy. See you later.